Hello everybody, my name is Joan Churchill and I'm so glad to welcome you to this video showing Alliance Medical Center in all its wonderful COVID things. I started at Alliance on March 16th, 2020, right when everything was closing down. But I got to see an amazing staff work really hard to make sure that there are services for every patient that wants them. It's just amazing to see this group of people work to keep things safe and to keep things fun while you're having health care. So a little bit about Alliance Medical Center. Alliance started in the early 70s, mostly to help people who were migrant workers. And over time, as the economy shifted, a lot of people who were migrant workers settled here in the Healdsburg, Windsor area, and we serve a lot of agricultural workers right now. We also serve elders, children. We are very, very lucky to be a nonprofit organization that has a mission to help every person, regardless of their ability to pay for healthcare services. And we do that along, I think there's about 1,400 other federally qualified health centers throughout the country. And we're really happy that our mission welcomes people who have Medi-Cal health insurance, who has Medicare health insurance, who has no health insurance, and who has a pretty darn good handful of other insurances. So if you're interested in getting care with us, especially after you look at all these videos of the great things we're doing, please give us a ring and we'll be glad to see if we can accept your insurance. Pretty much here in California, if we can't accept your insurance, it's because that insurance company won't allow an FQHC to bill for your services. So we're sorry about that, because we really want to help anyone who wants to come to us. So like I say, I started in mid-March. I got to meet most of the 120 or so people here who work for Alliance, mostly with their masks on because we have to mask. But I want you to know that I don't think I've ever seen a group of healthcare providers, support staff, clinical staff who are just really mission-oriented, really care about patients and making sure that we're doing the best on their behalf. It's a real delight to work here and to hear and see people really trying to help not only someone's health, but their well-being. And I can't wait to show you around and let you see for yourself. Now I'm going to talk to you about some of our services and how they may have changed because of COVID. So we have always provided medical care for an amazing amount of people, an amazing amount of different kinds of healthcare services. We've always provided dental care and behavioral health care. Now we can do it with a twist. We can make it actually easier for you to access our health care. Because of COVID, we had to do things differently. As you well know, we've had a lot of shelter-in-place orders. And how do you access health care when you're really not supposed to be out and about? Well, we turned to using our telephone and our televideo equipment. And you may have the televideo equipment right in your back pocket. A smartphone works, as well as if you have a Kindle or a computer or a laptop, any of those things, we can reach you and you can see us right from the comfort of your home. It's a really great thing, and it helps people. It helps people who don't feel well and are frail. It helps busy working parents who have to corral all the kids. It helps moms with newborns not wanting to wake them up. We can talk to you, we can see you, we can just help nurture you back to health from the comfort of your home. So please don't be afraid to try a telephone or televideo visit, at least for the first time. Now, it does take a little while to get hooked up, and that's something that we really will help you with. So we have videos to show you how to do that. We have nice people on the phone who can help you walk through that process. We try so hard to make it easy for you, and we're really happy about that. Another thing I want you to know is that our dental program is back in business again. As you may know, almost all dental services in the whole United States, except for emergency services, had to close in mid-March. And around June, we were able to open for limited procedures. So we really want you to come and feel safe at our offices. If we give you a ring and tell you we're ready to schedule an appointment, our providers are going to look like spacemen and women, I want you to know. They are wearing just as many protective equipment as someone going into surgery, and they're doing that to protect you and to protect them and the rest of the staff. We are just doing an enormous amount. We've always kept our places clean, so it's not necessarily cleanliness, but we're making sure that everything is sterilized after every patient. So it takes a little bit longer for us to see people sometimes, or at least we spread the appointments out longer, so we have a chance to sterilize everything that we didn't normally sterilize before. We are really, really happy to be back. Our dental staff are so happy to be able to serve you. And after we have some heating and cooling adjustments made to our systems, we'll be able to do all the services that we have always done for dental. For our healthcare services, we truly can provide an array of services, both, as I mentioned, with televideo and telehealth from the comfort of your house, or coming back to our office. What we're trying to do is to, in many ways, do part of the visit over the phone or on televideo and the rest of it at the office. So you can be here as limited amount of time as you need to be. So we might give you all sorts of questions to answer with us on the phone or in televideo, and then have you come in so that we can weigh you and take your blood pressure and things like that. So we are really trying to make it easy for you to be safe, to feel safe, and to not have to keep coming into the doctor's office all the time. We're so happy that we have acupuncture and chiropractic and all sorts of OB/GYN. We have a lot of different health services to help you and your loved ones be safe and healthy. Now, our behavioral health services, it's making it a lot easier for people to come into a weekly counseling session, because you can do it from your house, you can do it from your car. You probably, if you wanted to, could be walking around. We are doing all of our behavioral health services right now, or almost all, on the phone or with televideo, and it's really helping patients. People will tell us all the time that it's just so much easier for them to access us, that they somewhat feel more comfortable talking to us on the phone or televideo. And how much it has eased the burden that people have. It's really, really hard, as you know, to be living through the COVID era with not knowing if you're going to have a job the next week, maybe having a loss of insurance, family members being sick, just all the things that can happen. And we have counselors available to help you work through and talk about and see what you can do to take care of yourself, and to just take the deep breaths that you need to take so that you can move on. Everyone has those strengths, and we really want to help you to feel much better than you might be feeling if you're feeling stressed right now. So we just want you to know that we are doing everything that we can to make our care accessible to you. We have extended hours on our telehealth and telephone visits. Right now we have, I think our offices are open, our clinics are open basically from 8 to 5, Monday through Friday. We're trying to be here when you need us, and we are so happy that you are interested in Alliance and that we are providing care to you. Thank you.